Pain is the most common symptom in medicine. And when you look at patients, when you evaluate the number of patients going to see their doctor, especially their primary care physician, the number one reason they see them is for an upper respiratory infection. We all have colds, we have them all the time. But the number two reason is back pain. It overwhelms any pain clinic, and it overwhelms any other reason except for URI of visiting the doctor. We never felt pain before, but we start getting these creaks and we start getting these pains in our back, our neck, our hips, our knees, because the machine starts to age and we start developing arthritis at various levels. But we shouldn't rely just on pain relieving medications and medications in general. We should use the whole armamentarium that is available. Injections, physical therapy, electrical stimulation, acupuncture, hypnosis. There's a wide variety of things. The impact that chronic pain has on a person's psychological being. Very high percentage of those patients are depressed. Very high percentage of them have chronic anxiety disorders. We shouldn't allow pain to affect our daily lifestyle. We shouldn't allow it to modify what we normally do that brings us happiness and satisfaction with our lives. And we certainly shouldn't allow pain to force us to take large amounts of ibuprofen or Tylenol.
Epidural steroid injection with catheter, do we all agree?
We do.
She's been marked. Thank you.
Thank you. That was because the patient had had previous back surgery, had a laminectomy actually, and the patient had pain in her lower back, probably secondary to extensive scar formation in that area, and had referred pain down her legs. We inserted a needle through the tailbone opening at the bottom. We inserted a needle through here. We did it under fluoroscopic guidance so we could see exactly where we were. And we injected some contrast, and we took pictures from the side and pictures from the front to make sure that the area was filling adequately. We then ran a little thin catheter, a little tube, all the way up to the target area where we wanted the medication to concentrate at. And we gave a larger volume of medication because we wanted actually to make sure that the medication dispersed along the sites that are causing her pain, but also possibly to break up some of the scar formation. It was a very thick scar, and we saw that the medication reached here and very little of it went above the level. Next time we might do a different approach because we approach from the bottom. Next time we might approach from the top. That's why it's important that you go to a well-educated and trained pain physician that's comfortable doing all these procedures, and they do them under the controlled circumstances of a dedicated procedure room under fluoroscopic guidance. The pill mills are nothing but drug dealers. A red flag would be you go to a clinic, they take no insurance. They're cash only. All they do is prescribe narcotics, and you leave with a prescription of narcotics the first day you're there and nothing else, and your interview lasted 2 or 3 minutes. The Sarasota Memorial Pain Care Center is really exemplary for a variety of reasons. One, they have understood that being at the hospital is not the best model. The ambulatory model in the community is the best model. So we have established 3 separate, easy to access ambulatory centers where the patients come into a clinic setting and can be seen, evaluated, prescribed, and the procedures done all in the same setting with the same team.